Hi, I'm Dr. Nowruzi and welcome to my channel. Today we are going to explore the fascinating journey from traditional psychoanalysis to modern dynamic psychotherapy, the evolution of dynamic psychotherapy. To understand where we are today, we need to go back to the root of psychoanalysis. This journey begins with Sigmund Freud, often called the father of psychoanalysis. In the late 19th and early 20th centuries, Freud introduced groundbreaking ideas about the unconscious mind, repression, and the role of childhood experiences in shaping our personalities. Previously, we mentioned that Freud and Breuer used hypnosis to work with patients suffering from psychological conditions. Their work led to the birth of psychoanalysis, whose fundamental goal is for the client to truly experience their feelings and emotions. However, these feelings are often painful, conflictual, and unacceptable, leading the client to create barriers to experiencing them. These barriers are known as resistance. The therapist's task is to mobilize forces to overcome this resistance. The method a therapist uses to overcome resistance forms the basis for different types of psychodynamic therapies. Breuer used hypnotic suggestion to overcome the resistance. Freud initially used the method of hypnotic suggestion as well. However, Freud eventually innovated a technique that became a turning point in psychotherapy, the technique of free association. In free association, patients are encouraged to speak freely about whatever comes to their mind. Despite its innovative approach, the technique of free association had many flaws. These flaws, along with other criticisms of psychoanalysis, such as its subjectivity, lack of objective concepts and structures, lack of an organized integrated treatment plan, and excessive emphasis on sexual drives, led to the reconstruction of psychoanalysis. This gave birth to psychodynamic approaches that, while adhering to the foundational principles of psychoanalysis, aimed to develop therapeutic methods that are shorter, more economical, and have more organized and integrated structure with objective and measurable concepts. As it was mentioned, in free association, the therapist is not active and does not directly confront the client's resistance. And this prolongs the therapy that makes it expensive and not always practical for everyone. This led to the emergence of new ideas and approaches. The focus started to shift from long-term intensive analysis to more practical short-term treatments. Almost all attempts to overcome this problem and making the technique more effective have been based on making the therapist more active. Immediately following Freud, and shortly after his analysis with Freud, Sander Frenzy started to develop his technique of active therapy around 1920, where he became less passive and more active with patients, in part by setting a time limit on treatment. Otto Rank, a contemporary of Frenzy's, was also experimenting around 1924 with short-term treatment. He was the first to use time limits to specifically address his patients' separation problems. The ideas of Frenzy and Rank were, however, strongly opposed in analytic circles of the time and were seen as a threat to Freud's ideas. These reactions eventually led to a halt in the development of short-term dynamic therapy until sometime after World War II. Franz Alexander at Chicago Institute for Psychoanalysis was the next person to experiment with short-term methods around 1946. Alexander and French adjusted the treatment length to the patient's need. Alexander emphasized that the therapist could be more active if needed and need not be a blank screen. Peter Sifnos developed his technique of short-term anxiety-provoking psychotherapy in Boston University. Sifnos used a set of strict selection criteria to ensure patient responsiveness, motivation for change, emotional involvement, and active participation in treatment. David Malone developed his technique of focal psychotherapy at Tavistock Clinic in London. In this technique, the therapist actively directs the therapy towards a conflictual focal of client's problems and makes it the focus of the therapy. Malone makes clear, however, that the ability to maintain a focus depends very largely on the careful selection of responsive and highly motivated patients with an underlying simplicity of psychodynamics. The same applies to the technique developed by Sifnos. The result is that such techniques are applicable to only a small segment of the patient population. The fact remains that the bulk of patients suffer from long-standing complex psychoneurotic disorders and character neuroses and are neither well-motivated nor responsive, but poorly motivated and highly resistant. It is this problem that must be solved if short-term psychotherapy is going to have any impact on the psychotherapeutic services and the mental health of the community. Therefore, it was this problem that Dr. Habib Dawanlu, the Iranian psychiatric professor at McGill University in Canada, addressed himself in the 1960s and eventually found a solution. Dr. Habib Dawanlu developed his technique of intensive short-term dynamic psychotherapy, or ISTDP, that has since been taught worldwide. David Malone hailed Dawanlu's technique the most important invention in psychology since the discovery of unconscious by Sigmund Freud. Thank you for joining me on this exploration of the evolution from psychoanalysis to dynamic psychotherapy. If you found this video helpful, don't forget to like, comment, and subscribe for more content on mental health and therapy. See you next time.